Today we are talking about the classification of route of drug administration. Route of drug administration in pharmacology is the path by which the drug is administered or taken into the body. And drug administration in medicine, it is the act of giving a drug or treatment to the patient. So depending upon the route, the drug produce two types of effect. One is local and the other is a systemic effect. On these bases, route of drug administration is classified into a local route and systemic route, and it is further subcategorized into topical, intra-arterial and deeper tissue. So the topical route, this represent the application of the drug directly on the, and this also describe the drug administration by the applying on the mucous membrane. Mucous membrane is also called mucosa, which is the inner lining of body cavity or some organ, because the gland in the mucosa secrete a sticky fluid. So drug application upon this route represent the topical administration of the drug. Different anti-inflammatory drugs and antibiotics, topical creams and lotions and spray are applied on the surface of the skin. So this is the topical route. Mucosal administration, this is further subcategorized into different route. For example, otic route, which is the application of drug in the ear, and also optic route, administration of drug in the eye, or ophthalmic route. Similarly, it is another, that is nasal route, the drug administration on the nasal mucosa, and also the rectal route of administration, vaginal route of drug administration, and urethral route of drug administration. In a ear infection or otitis externa, different drugs are instilled in the form of drops, ear drops, for the local infection in the ear. Similarly, in the glaucoma or in conjunctivitis, the drugs in the form of eye drop, they are instilled for the local infection. And nasal route, it is for the different nasal problem, just like nasal decongestant like oxymetazoline or xylometazoline, to reduce the congestion, which is the swelling in the nasal mucosa. And a rectal, this describe the local administration of the different suppository, which is a solid oval shape or long oval and even a bullet shape medicine. These are administered, and these drugs have the capability to melt at the body temperature. So for local purposes, in the rectal, that is constipation, to treat the constipation, and even hemorrhoid, so the drug are applied or given by rectal route. And in vaginal route, different vaginal problem like the candidiasis, due to the candida albicans, clotrimazole, or even spermicidal drugs, these are administered by the vaginal route. And urethral route, when the drug are administered into the urethra in different erectile dysfunction in male, like drug like alprostadil, these are in the form of suppository administered. So this produces or this can solve these erectile dysfunction problem. So these are all the topical administration of the drug. Another local route, this is intra-arterial route. As the name suggests, that it is the administration of the drug directly in the artery, just like femoral artery or brachial artery, which bifurcates into the radial and ulnar portion. So the drug are directly injected into the artery. Specifically, these are anti-cancer agent, and also this intra-arterial route is also used for the diagnostic purposes. And just like in angiography, angiography is a type of X-rays to check the blood vessels. Blood vessels do not show clearly on X-ray. So a specific dye, which is called contrast agent, is injected into the blood vessels, and which helps the doctor to see the exact site of blockade or any other problem. So this intra-arterial route is also a local route of drug administration. Another route, that is a deeper route, in which the drug are administered into the deeper tissue for local effect. This include the intra-joint injection or intra-articular injection. Just like in case of rheumatoid arthritis, there is inflammation of the joint. So different drug like hydrocortisone, it is injected directly into this area for the reducing inflammation. And rheumatoid arthritis is an autoimmunity disease in which the body own cells, immunity cell, attack a healthy cell in a body, just like the Bajwa attack a healthy politician, Imran Khan. So in this case, this intra-joint injection is the deeper route of drug administration. Similarly, another route, that is retrobulbar injection, which is the administration of the drug directly behind the globe of the eyes for the eye surgery. Lidocaine or local anesthetic, these are administered in this area. So this administration is a local drug administration. Another deeper tissue, that is intrathecal administration, in which the drugs that are administered into the thecal region. For example, anesthesiologist administered the anesthetic into the thecal region or around the spinal cord, which is the thecal layer, and in the surgery or after the surgery, this lidocaine anesthetic, this drug is administered in this region. So this also include the deeper tissue administration of the drug. Although injections are used, but this produce a local effect. So this local administration of the drug comes under the umbrella of the local route.